Hi, I'm Casey Pinnock from Ball State Community College Respiratory Care Program, and this is Ariel Rippey. She'll be assisting me today in our rapid sequence intubation. Today we're going to be doing this on a small adult. And the first thing you'll want to do for rapid sequence intubation is gather up your meds before you start any procedure. You're going to want to have a sedative, and we're going to be using Deprivan or propofol. It's 2 to 3 milligrams per kilogram ideal body weight, and it's a IV push. This provides rapid onset and brief duration, and it's seroprotective, which means it decreases the intracranial pressure. It also depresses the respiratory system, which allows for an easier intubation. Also, you want to give a paralytic, and we are going to give Rekernium, and this is 0.6 to 1 milligrams per kilogram rapid IV push, which is less than a minute. Duration of action is 30 to 60 minutes, just enough time for intubation and stabilization of the patient. This is non-polarizing in MVA, and it has minimal effects on the hemodynamics and low incidence of histamine release. For the small adult, today we're going to be using a 7.5 endotracheal tube, and it is cuffed. Also be using a MAC 3 blade for intubation. You'll want to make sure that your light works. This way you can get proper visualization of the trachea. You'll also want to have a 10 milliliter syringe, and this is to inflate the cuff and deflate the cuff if needed during the procedure. You'll also want to have a colorimetric, and this is to make sure you have proper placement of the endotracheal tube in the trachea and not in the esophagus. And you'll also want to have a BBM with a mask and an adapter on the end. And all of these equipment, the ET tube and the blade, are all based off of the patient's age and body size. And the rapid sequence intubation sequence is you want to hyperinflate and hyperoxygenate the patient on 100% oxygen. So turn this up. I won't turn it all the way up in here. And you want to make sure that you have good chest rise on the patient before intubation. You'll also want to make sure that they are stable enough for the intubation. Keep here. You'll want to look at their EKG monitor and their pulse ox to make sure that we have their sat up and they have a consistent heart rhythm prior to intubation, especially if it's elective. You'll want to hyperoxygenate for a minute before the procedure is done, at least a minute, to make sure they are hyperoxygenated, and this gives you a cushion during intubation. The intubation should be no longer than 30 seconds in and out, and if it fails the first time, you'll want to wait at least 1 full minute in between attempts to make sure the patient gets hyperoxygenated again. And Ariel will be my assistant, so she'll be handing me my tube. And she'll also be auscultating for me after the procedure to make sure that we have proper placement of the endotracheal tube. So we'll hyperoxygenate, and you want to make sure the patient's head is in the proper position, and you can put a towel roll under the head, or you can have the patient's head slightly off the edge of the bed. And I'll get Ariel to test the patency of our cuff. And I would be bagging the patient during all this. And she'll check the patency by squeezing the cuff and making sure there's no rips or tears in it. That's fine. Okay. Then you want to hold your blade in your left hand, insert it on the left side of the patient's mouth into the vallecula with the MAC. And you'll want to lift up at the 45-degree angle, not using the teeth. For the blade, see the opening, visualize, and you also want to make sure the stylet is turned, tips in, this out, and you also want to make sure that the blade is always secure. Inflate the cup. And you'll see a color change from purple to yellow. me from yellow to purple. And we have equal chest rise. I'll get Ariel to listen to make sure we have breath sounds. Okay. So we have equal breath sounds, and you're going to be bagging on 100% oxygen to make sure the patient is still maintaining their saturation and getting enough oxygen. And then after this, you'll want to secure the ET tube with either a halter or tape, and then set them up on the ventilator. So I'll just take this off. And that was our rapid sequence intubation.